Welcome back to the TRT and Hormone Optimization YouTube channel. And as a guest, we have back Danny Bossa. Welcome, Danny.
Hey, Stephen. How you doing?
So, Danny, what about when your doc says, hey, man, your dose is too high, you have to lower it? When is the dose too high? How to lower it? Should they do it? What's your opinion?
Okay. This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way. When you're going for testosterone replacement therapy, you think you might need it. It's because you've established that, here are the symptoms I'm having. Maybe I got poor libido, poor erection strength, and my sleep is crap, and I'm not putting any muscle, and I'm getting fat, and I'm just kind of sluggish. I got no motivation. I got no drive. I got no energy. And you see, like, this is, you look at the symptoms of low testosterone, this matches. So let me go get this checked out, right? So you go to the doctor and you find out maybe you're low or you're mid-range or whatever it is, but you have all of these factors going on. And the doctor says, okay, let's try out doing TRT to see if it fixes these symptoms, right? Because you're not just doing this because of a level, you're doing it because I don't feel well and I would like to improve the way I feel. So you get on TRT and maybe it resolves all the symptoms. In my case, that's exactly what happened. It resolved all my symptoms. So you show up at the doctor and you say, hey, I've been doing this and I feel a lot better. The libido's better, the erection strength is better. I sleep better. I wake up, my thoughts are clear and I'm thinking clearly and I have drive and I'm getting so much done during the day. It's fantastic. This is great. I think I'm good. But the doctor then goes, he says, yeah, but looking at because you're over the range. You're over this range. So we have to lower your dose. Okay. So you lower the dose because the doctor says you got to lower your dose. Suddenly the symptoms come back. You go back to see the doctor 2 months later and the doctor's like, so, how's it going? I don't feel as good as I did before. This issue came back, this issue came back, this issue came back. And the doctor's like, yeah, but you're fine now. Your levels are okay. You're in the range, so your levels are fine. But I don't feel fine anymore. So if I don't feel fine, why am I going to take a treatment that's supposed to help me feel better if it's not going to make me feel better because I have to be in this range? So then the doctor will probably agree, okay, well, let's increase your dose a little bit to see if it helps. So you increase your dose, suddenly I feel better. Yeah, and now you're above the range. This type of thing, this vicious cycle between patients and doctors, we see it all day long. It drives me nuts. The first 2 years I spent on TRT was exactly like that. As soon as I felt better, they wanted to lower my dose. And then they lowered my dose and I felt worse. And then I had to argue to have my dose brought back up and they'd bring my dose back up. And now suddenly I feel better and then they wanted to lower my dose again. Docs and patients, you can't go by the range. You cannot go by the range. I'm going to say it again just in case you didn't hear it the first 2 times. You cannot go by the range. Stop using the range. The range is useless. It's pointless. It's useless. Forget the stupid range. Okay? If you have a guy that's at the bottom of the range and he's at the absolute bottom or he's below the range, you get that. He's going to need testosterone. If the guy is mid-range and he has all these symptoms and you put him on testosterone and now he's at the top of the range or maybe higher than the range and he feels better. His health is going to improve. He's going to have a better quality of life. Why would you lower it if testosterone has never been demonstrated to cause harm? You've helped the guy out. You've improved his health. You've improved his quality of life. Leave it alone. What if the guy is at the top of the range, has all these symptoms? I know you say to yourself, well, if he's at the top of the range, he should be fine. What if he's not fine? What if he's not fine? What if a guy has total T of 800? I feel like crap. And I'm not talking about a guy who's, he's 25 years old and he's trying to, let me trick my doctor. I'll tell him that I'm not feeling too good so I can get some testosterone legally and I can get my levels up. And then when I train, I can put on muscle. No, we're talking about men in their 50s, 60s, even 70s. Sometimes they have really high levels of test on paper, and they have every single symptom of low testosterone. You'll find the doc every now and then. They'll say, you know what, let me try boosting it up and see what happens. They boost it up, suddenly their symptoms go away. What's the issue? Why are we so caught up with this stupid range and these stupid numbers? Okay. My testosterone levels right now sit somewhere between 1200 to 1400 at any given time. My free testosterone right now sits anywhere between probably 35 to 45. My health has never been better. I've lost fat. I've put on muscle. My skin looks better. I sleep better. Everything about my life, my day-to-day is better across the board. I'm reaping the benefits. There is no doctor on the planet that could possibly convince me to now lower my dose because I'm higher than the range, especially considering the damn range keeps going down year after year after year after year. I look at the labs from 5 years ago, the ranges I had compared to the labs of today, and it's astonishing the difference. They're basically saying, let's get it as low as possible so that for someone to be at the bottom or lower than the range to warrant treatment would be like next to impossible. You know, and then if at the top, well, anything above that, no, we're not going to do that. We're going to keep them lower. It's as if they're purposely trying to keep people sick. I don't get it. Docs, you do not need to lower the dose. If you do, you need to provide some kind of evidence that this level of testosterone is going to cause harm. But with 80 years of study, there's no harm found. So why are you telling the guy to lower his dose? The whole point is to make the guy feel better. Right? If I go to a doctor and I say, you know, doc, I'm all stuffed up and my sinuses and this and that, and I can't breathe, and they take a look and they say, you got a sinus infection. We're going to give you antibiotics. It's going to help to clear up the sinus infection. It's going to make you better. You will not have the symptoms anymore. Perfect. I take the antibiotics without thinking. Everything gets better. I call back to see the doc. Doc, great. I can breathe. We're good. Why isn't it not the case with testosterone replacement therapy? You're going to a doctor and say, I feel like this, like this, like this, like this. Okay, let's try that. The symptoms are gone. No, you got to lower because of the number. Stop obsessing over the damn number. You may need to get some guys at 1,400 total, 1,500 total, 1,800 total. It doesn't matter. It doesn't matter. I know you think it does, but there's no evidence that it does. Okay. Of course, you still need to monitor, serum levels like, hematocrit, hemoglobin, keep an eye on lipids. It's not as important as big of a deal as we once thought, but just keep an eye on blood health. Also, doctors telling people to donate blood when their hematocrit hits like high 40s or low 50s. It's not necessary, guys. If you're having zero symptoms and you feel fantastic, you can be up into the high 50s. Most docs I talk to even say you're probably going to get into 60s before you're going to start donating blood, unless you have any type of symptoms like maybe high blood pressure or whatever else. And obviously, if you feel better donating blood, you do it. And for some reason you feel better, by all means. But it's not something that you necessarily need to do if you are in good health. Okay? I wish everybody would just stop with the whole, your dose is too high, or this dose you're taking is a steroid cycle. Okay? Dose is irrelevant as well. Again, I've talked about this many times. I have to take 300 milligrams of testosterone to get the same levels that some of my friends have to achieve with only 150 milligrams of testosterone. They're taking 150, I'm taking 300. Our serum levels are the same. But apparently I'm on a steroid cycle because I take 300 milligrams and they don't take 150, but our serum levels are identical. Dose is irrelevant. Get the guy feeling good. How do you get a guy feeling good? Give him the minimum amount required to resolve the symptoms. Okay. So if you get to a point that you feel like your symptoms are all resolved, stop there. That's the whole point. You want it to feel better. Now, if you keep adding and you keep adding and you keep adding and you keep adding and you keep adding, well, now you might be pushing it. Now you might have side effects. Now we don't know.
Before we continue, if you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian and UK Amazon stores.
Just keep things that you feel good. Once you've established how much you got to take a week and the frequency of injection, leave it alone. Docs, there's no reason to lower people's dose based on the labs. Now, if you do want to lower it, you have to provide some kind of evidence to the patient as to why you're going to do it. I know no evidence is out there because we've looked. All we have is evidence and studies of benefits. So just stop doing it. Okay, guys? I don't know what else to say. This is something that comes up so often, and it drives me nuts to hear people. I suddenly felt better. I'm suddenly doing well, and now they lowered my dose, and now I feel like crap again. I don't see the point of how you would want to treat a patient and make it that he feels like crap because of a number on a piece of paper. I don't get it.
Me neither. Awesome. Thank you, Danny. Hey, thanks for watching. And now click on one of these thumbnails to learn a ton more about TRT and hormone optimization.